I think I kind of know the answer, but I just would like it to ask anyways in the public setting. For that attachment to the joint of commitment, that includes the infrastructure life cycle and the tripartite agreement, part of which is to assess building and asset conditions. I guess when these conversations were had initially, what's the intention for the resource to fulfill that? And was it always just anticipating this budget cycle with the service package, or was there kind of some other, I guess, intention at the beginning during the tripartite, like, negotiation and all that?
Yeah, I think, part of the tripartite agreement and discussions with EFCO has always been around how we can support them, and understanding that the amenities and the infrastructure portions of that, are we working towards ensuring that they are kept up to date in that. So from a resourcing perspective, we didn't really get into those types of conversations necessarily exactly, and I think that that's why the service package coming forward is looking at saying, let's allocate some specific funding towards doing that, so that we make sure that we're staying on top of it.
And just in the context of the broader asset assessment that city does in general, I think we've had a lengthy conversation on it during the last, I think, renewal conversation. Are league infrastructure part of that general assessment?
They are, and one of the key things is that they've set up that database that we're now working together on, and that's providing some of that initial look at what state they are, and then guiding us in that direction of going out and starting to take a look at those infrastructures and making sure we're doing good assessments on them.
So the service package, when it comes to the infrastructure piece, with the tripartite, has taken that piece into consideration, accounting for all the internal resources that the city will be providing already. Just is that right?
I will have to get back to you on that.
Yeah,
yes,
I mean,
I believe it is, but
okay.
I don't want to give you any kind of incorrect information.
Yeah, I just want to make sure that whatever is being put forward already has some of these considerations of the things that we're already doing, leveraging existing city resource, and this is kind of like that gap that's needed for EFCL to undertake some of that.
Yes.
Okay, and then the other thing I was curious about is the operational funding for EFCL for the $526,000 a year has stayed the same since 2014. Never mind, changes in inflation and all that. I'm assuming this amount will remain the same in the base budget going in. And so any way of kind of making sure that this is on par with inflation and all that would be coming through in the form of the second service package in terms of broadening their scope. Is that correct?
Yes, correct. So there's the base amount, and then the service packages that EFCL is presenting is to start to work towards the inflationary increases and the fact that there hasn't been an increase since quite a few years.
Yeah, and I think with the pandemic, the needs have also changed and broadened. So anyways, appreciate you answering some of those clarifying questions, and I look forward to debating this during budget further.
Thank you. Any further questions for administration? Hearing none, then a motion to move the recommendation in the report.
So moved.
Okay.
Shall I read it out?
Sure, it's on the screen at this point.
Okay. That the collaborative relationship agreement between the City of Edmonton and the Edmonton Federation of Community Leagues is outlined in Attachment 1 of the October 25th, 2022 Community Services Report, CS01485, be approved, and that the agreement be in form and content acceptable to the City Manager.
Thank you. Motion on the floor. Anyone that cares to speak to it?
I look forward to seeing the service package when it comes forward.
Okay, we'll call that closing. Please vote.
Sorry, are we voting?
Yes, we are.
Can you hear me?
Yes.
Oh, it hasn't come up. Yes, in favor.
Thank you, Councillor Jans. We have 4 votes.
Please display the vote. That's carried. Good, thank you to everyone on that. This takes us to item 7.8, amendments to traffic bylaw 5590.
Today we have a report in front of you with an amendment to increase the fines for seasonal parking ban violations. The report is a follow-up to the snow and ice control discussion back in June of this year, where conversations around non-compliance of vehicles being removed from the street were affecting the service delivery of our snow and ice removal operators. Administration is requesting that the parking fine be increased from $100 to $250 to align it with other bylaw violations, but also to act as a deterrent to vehicle owners who do not remove their vehicles from the street during a snow ban. Encouraging vehicle owners to remove their vehicles is vital in allowing snow removal operators the ability to remove snow from the streets in a more effective and efficient manner. Thank you, and we are here to answer any questions you may have on this report.
Great, thank you. Sorry, Councillor Tang exempted this. Questions of admin?
Yeah, I just had a couple small questions. I think there's a line in there about wanting this to be in alignment with similar bylaw infractions, to bring this more in alignment. Just wondering, like what? And also, actually, I'll start there. Go ahead.
Sure. Most of the bylaw violations that we have are currently at the 250 mark. There are a few that are at the $100 mark, and so this is just aligning that, understanding that it's also, we haven't seen a lot of compliance at the 100. So by bringing it up to the 250, hopefully we'll both see one, alignment, and two as well, some increased compliance.
And so with the 250 ones, can you just give me some examples?
Sure. 250 might be things like nuisance property, if there is, signs. Most of our bylaws that we have are 250.
Okay, and then you're finding compliance at that level is actually a lot better?
Correct. And there's a fine balance there, but certainly it does act as a bit of a deterrent.
Interesting. And how is this consistent? How would this bylaw change? How does it compare with other winter cities?
Well, I mean, I think each municipality has their own, set of bylaws and set of focuses. Calgary might be a lot more specific and in nature. However, we do align with, the major cities like Calgary, and whenever we do any kind of increase or bylaw review, we're always looking at the jurisdictional scans to ensure that we're in alignment and that we're very similar.
Okay, that's good. And then just in terms of the increased proactive snow on sidewalk enforcement, I'm just wondering, but what about those people who have legitimate challenges removing the snow on their sidewalk, like seniors and those with disabilities or those who are, chronically ill? Are the officers going to do kind of a welfare check first, find out what's going on before issuing any kind of ticket? And actually, I'll stop there, and then I'll follow.
For sure. I mean, it would be, from a deployment perspective, pretty difficult to start to do welfare checks and to knock on doors prior to doing that kind of enforcement. However, we do have a number of programs, for instance, our Snow to Go program, which is, providing grant money to community leagues and to areas, as well as working with Disability Edmonton to ensure that when there are properties that are identified as having individuals who may have difficulty removing their snow, that supports are provided there. In addition to that, when somebody does receive a fine or in order to clean up the snow on the sidewalk, we do our best to be able to resolve those, if they are brought to our attention.
Okay, I'm glad to hear that. But just in the event that, they have a legitimate challenge and they do receive a ticket, there is a very clear process for them to maybe dispute or to investigate, and they would do that through 301?
Yes, through 301 and also the city website, there is an appeal process for somebody who does receive, a snow and ice fine. But we really do our best to try and make sure that we are providing some additional supports and communicating it out there, and then working with the communities if there are properties and individuals who are identified as having difficulty.
Yeah, that's good. And I hopefully, with some of the changing practices this winter, we might have less of the snow. the freestyle that we saw, a lot of people having difficulty. I got lots of emails, especially for just seniors, like it's so hard for them to keep at the sidewalk, and many people who are ill, just unable to even get out of the house. And finally, I think you mentioned some of the community support programs, but we also have the assisted snow removal program. So I was wondering how might that enforcement intersect with, the assisted snow removal program?
Well, certainly I think that we work with any community and the agencies and those types of programs.
Sorry, so that program is by us?
Correct.
Right, and
Yes.
so, I guess similar, would there be some communication between our enforcement officers and the snow team, to be
Yes.
like, hey, are you guys doing the assisted program at this location so that we don't,
Yes,
But I understand that can be difficult to coordinate.
it is,
that's it.
and trying to align the work that we do from the enforcement perspective, as well as all the programs and the granting and the assisted programs that we provide out there, is difficult. But we do our best to try and make sure that we're aligning that work, and I think we're doing a pretty good job of that. Whenever somebody certainly raises a concern or brings something to our attention, we're really good at looking at that and making an assessment and doing the right thing.
Yeah, thank you so much, and I appreciate your teams keeping, I guess, some of our vulnerable Edmontonians' needs top of mind.
Thank you. Councillor Wright.
Hi, thank you. I'm just wondering, so with the ticketing, how, and then towing, how close together are those? Like, are people like sort of given overnight to when they come home from work to get the vehicle moved, or is it done right away?
So part of the work with regards to this parking ban program, we're working through what that's looking like. But certainly there's going to be plenty of communication prior to. We're looking at having officers go out there in advance of the machinery and the snow removal crews, giving warnings, trying to encourage compliance. And then at that time when the snow crews are arriving, we would be looking at ticketing and then towing immediately around in order to make sure that the crews have the ability to be able to clean effectively and efficiently.
Okay, and I noticed that you can also, I got an email this morning saying that I could sign up for notifications as
Correct.
well. Okay,
Yes.
So residents can take measures to avoid this themselves. And I'm just also wondering, what's the rate of people paying these tickets? What percentage of people pay them?
That's a great question. I think Tracy Esch from Law Branch is on and might be able to provide a little bit more information on that.
Hi, Councillor Wright. This is Tracy Esch from Legal Services. So I don't actually have the number in front of me of the percentage of people who pay versus those that challenge them through the court process, but that's probably something that we could, with Keith Scott's team, look into and get back to you with a number on that.
Okay, I'm just wondering if there would be any incentive to have them pay a reduced amount within a certain limit, if they, pay it within 3 days or something, would that get them to pay it more? I know at one time on parking tickets, way back when I got one, there was that option to pay it early at a reduced amount.
Yeah, currently there is not that option available.
Okay.
But certainly I'll have conversations with Law Branch to see if that is something that is able to be done or whether we're not able to do that.
Okay, thank you. I know the idea is to get people to stay off the streets, but okay, thank you. That's all I have.
Thank you. Councillor Jans.
Thank you, Mr. Chair. Just quickly, could we get clarification how we arrived at this fine amount?
Certainly, Councillor Jans. The fine amount brings the parking ban violation for parking on streets from $100 to $250, and it aligns with the other bylaw violations that are currently out there.
And when was the last time it was increased?
Which, the parking van violation?
The snow fine. I guess where I'm coming at this is, in my area, I have a lot of seniors who are quite literally stranded if the sidewalks are not cleared. And often we have a case of many landlords on Vancouver Island kind of situations where they just are not getting it done, and they're kind of rolling the dice that if they get a complaint and if they get a bylaw person show up and if this all takes place, $100 is pocket change, and I'm concerned that $250 is still not enough to really send the message that mobility is a human right, and you not shoveling your walk and you not taking care of your property is actually causing slips, falls, harms, and sometimes lifetime injuries and concussions to your neighbors. And I'm just wondering about, I'm considering an amendment to see that fine go even higher, given the fact that I've heard about the mitigating circumstances for others, and I also see that we're bringing in the text and email notifications as well.
Certainly. So just for a little bit of clarity, so the report that's for you today is for increasing the parking ban violations from $100 to $250. The snow on sidewalk fine is still $100.
I see. Okay, I'm sorry, I misunderstood that. Thank you for the clarification.
Okay.
I have no further questions. Thank you for that.
Okay, thank you. Any further questions then from anybody for administration? I'll take a motion to move the recommendation in the report.
I am happy to move that the Community and Public Services Committee recommend to City Council that bylaw 20272 be given the appropriate readings.
Thank you. Motion's on the floor.
And if I could just clarify, that would be going to the November 14th City Council meeting.
It would have to at this point, yeah. Not Monday, but the subsequent
Correct.
meeting. Okay. Anyone speaking to the motion? Councillor Tang to close.
I just want to thank the administration for doing this work, for raising, this is something that I think we've been talking about a lot in terms of our snow and ice strategy and, and tactics on the ground. And actually looking forward to more compliance so that, our teams can actually get out there and do their work. I'm pleased to hear that, this is about bringing it in alignment with others, and I look forward to see how it might improve compliance in general. So thank you very much for this work. That's it.
Great, thank you. Please vote.
I am in favor.
Thank you, Councillor Jans. We're just getting the vote sent out now. We have 4 votes.
Please display the vote. That is carried. That moves us then to item 10.1, bylaw amendment for indoor shisha consumption. So we'll go to Councillor Wright to put her motion on the floor. Before I do that, sorry, go ahead. Put your motion on the floor. I'm sorry, Councillor Wright, go ahead.
Okay, thank you, Chair. So I move that administration engage with stakeholders, including Alberta Health Services, to evaluate mitigation measures developed by the shisha industry and provide a report with the results for a due date of Q2 2023 Community and Public Services Committee.
Thank you. So motions on the floor. We'll go first of all to administration, perhaps for some opening comment. And then we do have speakers. I'll have to move a motion in a moment for speakers.
If you'd like, I can provide a bit of context and history, or I can wait
Sure.
for questions.
Yeah,
Okay.
go ahead. Yeah,
Sure.
Thank you.
So in 2019, Council decided to ban the smoking of all tobacco and tobacco-like products indoors. This required an amendment to the Public Places bylaw, and the wording was intentional to cover both shisha and cannabis products. As there were multiple shisha operations within the city, extensive engagement was undertaken to inform them of the impending decision, and a phase-out period of 1 year was put in place. In 2020, the bylaw was amended which effectively required all operations which had permitted shisha smoking indoors to cease that activity. A further motion was made to look at how the activity could function within a set of mitigation regulations put in place, and that report was brought to committee in 2021. At the 2021 meeting, the report was accepted for information with no further direction to amend bylaws. The shisha industry was advised to engage with the province about any potential areas they felt that could mitigate the issues that were discussed. So the unresolved challenges that led to the banning of smoking tobacco and tobacco-like products that are to be resolved include: there's not an effective enforcement model to differentiate what is and is not tobacco. There are occupational health and safety challenges to those who work within the spaces where products are smoked, including any inspection staff with the City of Edmonton or provincial health inspectors. A lack of proven ventilation to make the space safe. Ongoing public health concerns as identified by Alberta Health Services when ingesting products through the water pipe smoking. To date, administration has not heard from industry about the work that has been done recently, but if this motion was approved, administration would engage with stakeholders, including Alberta Health Services, and provide a report with recommendations on any potential bylaw changes. Thank you.
Great, thank you. And we'll now go to our speakers. Now, I need to move a motion to hear from those speakers. So I will move that committee hear in panels from the following speakers. Les Hagen from the Action on Smoking and Health Canada, who's here in person. Who said he's here in person? I don't see Les, though. Oh, he is online. All right, okay. Emily Drake, Heart and Stroke Foundation, who's joining us remotely. And Avnish Nanda from the Edmonton Hookah Cultural Society, who's here in person. Very good. Okay. We'll get Avnish to come up to one of the seats up front here, sir. We'll get you in front of a microphone when your turn comes. Just a reminder then to all of our speakers, you each have 5 minutes to make your presentations. Those of you online, you'll see a timer on one of the screens, and so we just ask that you hold your remarks to 5 minutes each. For those in person, you'll see that there's lights on the counter, green for the first 4 minutes, yellow for the last minute, and red means that your 5 minutes is up. Once we've heard from all of the speakers, council and committee will have an opportunity to ask each of you questions. And once we've completed all the questions, then we'll return to questions of administration. Thanks everyone for being here. Appreciate your attendance. Mr. Hagen, you're first. You have 5 minutes. Thank you.
May we vote on the...
We didn't vote on the motion. I'm sorry. Let's vote on the motion. My apologies. Thank you, Madam Clerk.
Councillor Jans?
In favor.
Thank you. We have 4 votes.
Please display the vote. And that is carried. Sorry for missing that. Now you have 5 minutes, Mr. Hagen. Thank you.
Thank you, Mr. Chair. Can you hear me?
We can. Yep. Go ahead.
ASH is one of Canada's leading tobacco control organizations, and we're based in Edmonton. I would like to commend City Council for protecting public health through the implementation of the 2019 prohibition on shisha smoking. However, we're very concerned about the motion to reopen this debate and to compromise existing public health standards in Edmonton. Water pipe smoking in public settings has been banned in several Middle Eastern countries where it was smoked for centuries, including Syria, Lebanon, Turkey, and Jordan. The East African nations of Tanzania, Rwanda, and Kenya have also banned water pipe smoking, in addition to Singapore and many jurisdictions in India. There's been a similar trend across Canada. 8 provinces and territories prohibit smoking of all water pipe products in places where smoking is banned. A growing number of Canadian municipalities have amended their indoor smoking bans to prohibit water pipe smoking, including 12 Alberta municipalities. Here are 10 good reasons why City Council needs to stand by its original decision and continue to protect Edmonton residents and hospitality workers from secondhand smoke. Number 1, according to Health Canada and the World Health Organization, there is no safe level of exposure to secondhand smoke. Secondhand smoke contains dozens of toxins that pose significant health risks, especially to those with underlying health conditions such as asthma, allergies, and heart disease. Secondhand smoke from hookah pipes is just as harmful as secondhand smoke from cigarettes. Number 2, there is no practical means of ventilating secondhand smoke, and for this reason, ASHRAE is now recommending against the construction and operation of separately ventilated smoking rooms. The American Society of Heating and Refrigeration Engineers is North America's leading ventilation authority. Number 3, all workers deserve full and uniform protection from secondhand smoke in the workplace, including those who work in the hospitality sector. No one should be exposed to secondhand smoke at work. 4, hospitality workers often represent precarious, hospitality jobs often represent precarious employment, and these workers are often earning the minimum wage. Many of these workers are unable to demand a smoke-free workplace without risking serious employment consequences. 5, City Council has created a level playing field for all hospitality businesses by prohibiting all forms of smoking in public establishments. This level playing field will be undermined by exempting hookah bars, and these establishments will have a competitive edge over other businesses that is based on the presence of a public health hazard. 6, hookah bars received a lengthy 15-year exemption from the ban on smoking in restaurants and bars. This extended delay provided these establishments with a tremendous amount of time to adjust their business plans in anticipation of a ban on hookah smoking. In sharp contrast, hundreds of Edmonton bars and restaurants only had a few days to adjust their business plans when the COVID-19 restrictions came into place in 2020. Number 7, hookah smoking has been prohibited in dozens of Canadian communities, including 12 Alberta municipalities. The City of Edmonton has been a leader in protecting its residents from secondhand smoke in public establishments and workplaces. 8, City Council should continue to support efforts to enhance public health and the quality of life, especially during a public health pandemic. Number 9, hookah smoking contributes to the spread of communicable diseases, including hepatitis, meningitis, herpes, and COVID, not hepatitis, including meningitis, herpes, and COVID-19. Number 10, only 1 in 5 Edmonton respondents support restoring hookah bars, according to a Leger marketing opinion poll of 506 residents conducted in February 2021. Based on the need to protect workers from secondhand smoke and Council's previous efforts to create a level playing field for all businesses, we urge Council members to maintain the current smoking bylaw restrictions without exemptions for hookah smoking. Thank you.
Thank you, Mr. Hagan. We'll now go to Emily Drake.
Thank you and good day, Chair and committee members. My name is Emily Drake and I'm the Specialist of Health Policy and Systems for Alberta at the Heart and Stroke Foundation. And I'm here today to speak regarding the revisiting of the issue of water pipe or shisha in indoor public establishments. On behalf of the Heart and Stroke Foundation, I would like to applaud the City of Edmonton for working to protect public health through the implementation of the 2019 Public Places Bylaw, which prohibited water pipe smoking in indoor public places and workplaces. However, we are very concerned about the revisiting of water pipe use in indoor public places and workplaces. A reversal will undermine public health by putting water pipe establishment staff and patrons at risk of chronic and infectious disease, including COVID-19. I would like to reiterate important research outcomes and evidence illustrating the need to control public indoor use of water pipe in order to protect public health. Extensive evidence indicates that water pipe use is associated with lung cancer, respiratory illness, low birth weight, carbon monoxide poisoning, and adverse cardiac events. Both firsthand and secondhand smoke produced by water pipes contain known carcinogens at levels equal to other tobacco products. People who are exposed to water pipe smoke are at risk of the same negative health outcomes as individuals exposed to secondhand tobacco smoke, even when herbal water pipe products are used. There is no safe level of exposure to secondhand tobacco smoke, and that includes all water pipe smoke. This exposure occurs no matter the ventilation processes applied. Significant evidence indicates that HVAC systems do not provide protection from secondhand smoke exposure in indoor public places. The technology required to eliminate exposure to secondhand smoke does not exist. In July 2020, the American Society of Heating, Refrigeration, and Air Conditioning Engineers, the global authority on ventilation systems, effectively abandoned its guidelines for designing ventilation systems for smoking rooms. Permitting the allowance of water pipe use, even with the use of a smoking room, will not provide protection and will expose all individuals on the premises to dangerous levels of secondhand smoke. As well, the current smoking bylaw provides a safe workplace for all individuals, and we must maintain that. We know that many individuals working in the hospitality industry, including those working in water pipe establishments, are earning minimum wage and may already be confronting health inequalities as a result. Their exposure to secondhand smoke at work represents another health inequality, which is unfair and unjust. Many of these workers are in vulnerable positions and with precarious employment, and they simply cannot ask for a smoke-free workplace. We must remember that everyone deserves uniform protection from unsafe work, including exposure to secondhand smoke in the workplace. It is also important to remember that a prohibition on water use in indoor public places and workplaces was also a component of the Alberta Tobacco and Smoking Reduction Act passed in 2013. Even though that section of the Act has not been proclaimed, businesses have had many years to prepare for the likelihood of a phase-out of indoor water pipe use. It is also a concern that the city is interested in making changes that will create an unlevel playing field for businesses and possibly set a precedent that may lead to further exposure to secondhand smoke of tobacco or other smoke substances in indoor workplaces. Focusing on providing a small segment of the hospitality industry with ineffective options, which will lead to increased costs for businesses and increase the burden on public health, is not a public benefit. I would also like to reiterate that the current bylaw does not prohibit the use of water pipe or stop consumption. The bylaw indicates where water pipes can be used in order to protect public health, which is fundamental to the well-being of Edmontonians. The evidence-based smoke-free policies developed and implemented in Edmonton's smoking bylaw take a population-based approach to improving health, which reduces health disparities and benefits people throughout society equally. By maintaining strong smoking restrictions, including the control of water pipe use in indoor public places and workplaces, Edmonton will continue to be a provincial leader in providing safe, smoke-free spaces for all of its citizens. Thank you very much for your time.
Thank you. We'll now go to Avnish Nanda.
Hi, I represent the Edmonton Hookah Cultural Society. We represent shisha loungers or former shisha loungers in Edmonton, but also large segments of the African, Arab, and South Asian communities in Edmonton for whom shisha consumption is an important part of their cultural practice. I appeared before this committee last year or the year before about the same issue. The concerns that my clients have, both community members and shisha lounge owners, is when this ban came into effect, we weren't even consulted. A small group of shisha owners were consulted, and the inability for city admin and those small group of shisha owners to reach an understanding around these issues led to a complete ban, and that entire process excluded the impact cultural communities for whom, with the ban, shisha consumption has not stopped. Shisha consumption has just occurred in unsafe settings, usually in the home, with there are minors and others folks around. At the last committee hearing we had, much of the same things that my friends have indicated were stated. And just like then and today, there are a lot of misstatements. The foundational misstatement is that linking shisha consumption in the commercial setting in Edmonton to tobacco consumption. Tobacco has not been consumed in shisha establishments in Edmonton, I think, since at least 2005. The provincial restrictions on indoor tobacco consumption don't apply to shisha because shisha and the products that are smoked in commercial establishments aren't tobacco. The City of Calgary was, the same motion by the same individuals were put forward in the City of Calgary. The City of Calgary rejected their request for a ban because two things. The City of Calgary actually did a consultation with cultural communities and people who directly consume shisha and for whom it's an important cultural practice. And the response was overwhelming that this ban would have negative effects on their community, their ability to practice their culture, and also it would just lead to more unsafe shisha consumption in the home. What we're asking today is not for shisha consumption to be reinstated. We're asking for a fair process where city admin can look at the evidence, look at our proposal from an engineering perspective, to engage in that due diligence that it ought to have done at first instance, and then bring the findings back to City Council to have a fair and open debate with all information and all the facts on the table to ensure that my clients and the cultural communities I represent can have a fair debate. a fair process to determine something that will have a significant impact on their lives and future generations of African, Asian, South Asian, and Arab communities within the city. Those are my comments.
Great, thank you. And I'll go to questions of our speakers. Councillor Wright.
Can I do sort of an introduction of the motion as well?
Oh, I'm sorry, did I miss that? Sure, go ahead.
Well, so part of my rationale bringing forward this motion again, and I know it has been debated extensively previously at council, and I don't think that this is the time to debating the merits or the risks associated with this. I think that needs to wait until we have further information, further analysis that's being brought forward. And I think the industry has done extensive work, so it does bring into play new data, new information for council to be assessing from what was previously provided. I understand that they've done some work to mitigate the risks that were identified, the OHS risks that were identified by Alberta Health Services, and so I think at that point is when we would be debating that. So I really don't have any questions at this time for any of the speakers, but I do appreciate them all showing up today to voice their opinions. Thank you.
Great, thank you, Councillor Wright. Councillor Tang.
Great, thank you all so much for coming in. I do have quite a bit of questions. I'll start with Avnish here. Thank you very much for those statements. Can you also speak to a little bit of your conversations with the community and the industry, what they have done since the last policy was put in place? And have you had a chance to present any of those updated work?
Oh, and that's an important point that I missed, is that at the last committee meeting, the concern was secondhand smoke exposure or secondhand product exposure to staff members. And even before that meeting, in discussions with city admin, industry's #1 policy or proposal was that they would develop a mechanism that's kind of steeped in science and engineering foundations to ensure that no employees at any of these establishments would be exposed to any secondhand shisha smoke. So at that hearing, we actually retained an engineer. If you may recall, we made a presentation, but the concern of certain committee members, Councillor Knack, Councillor Paquette, and others, was that we needed better data. We needed to test this, to model this, to see if it'd be effective. So we spent that 1.5 years doing that work at my client's own costs, and we have modeling to show that this mechanism that is based on kind of smoking, ventilation, and similar concerns in the industrial setting, in the oil and gas setting, we're taking that and putting that in the shisha context. So negative air pressure, 2 different types of high ventilation systems, air vacuums, things of that nature.
Yeah, so appreciate that at that last conversation, some of the council concerns was that we don't have enough data. So you went away and tried to collect some of that data, but then because it's a ban now, there's just no opportunity to even bring that back. And kind of what you're asking for isn't a reinstate the practice, but to say we want to maybe share some of the things that we have learned in that process and for that fair process.
Yeah, basically, we want to continue on that conversation. That committee said, go and find that information, come back, let's have a further conversation. We're just here to have that conversation.
Do you worry at all about if we reopen this conversation, it sends a signal, whether or not you are here to advocate for reinstating that or not, but it sends a signal to say reopening of other things like cigar lounges and that kind of stuff?
That's not within the municipal jurisdiction. The province has legislation on tobacco consumption in those settings and has banned that. Mm-hmm. This province has also said that shisha consumption is strictly within the municipal government's authority, which is why Calgary has gone a completely different approach than Edmonton.
Mm-hmm. Right. Regardless of jurisdiction, I think it still potentially might send that signal, right? And that, I think, one more question for you. I think in the past, people have compared this conversation with, say, allowing drinking in parks and highlighted, some of the inequity there, considering predominantly the communities that are going to be affected. Wonder if you can speak to that a little bit.
Well, there was no GBA plus analysis of the policy ban, and last time when this came back to committee, even though this is a priority for this council, and I just think that's striking, there was no consultation to any of those broader members of those communities that access shisha lounges, and I just don't know how that could happen in 2021 or 2022 with the demographic makeup of the city. This is a disproportionate impact on particular communities in the city that are historically marginalized from city decision-making and processes. And when you're making decisions that impact them, they should be engaged at the very least. I should also state that what this does signal to people, particularly among the communities I represent, is that their voices matter, that their lived experiences matter, that the city is not just going to make significant decisions that impact their lives, their communities, their cultures, without knowing the full facts and adequately consulting them.
Even if the outcome isn't what they want to see?
No. At this stage, we're just saying like that process before was not fair. Certain voices were elevated over other voices, and we want to revisit this issue with everyone at the table, with all the facts available, and where things land, they land.
Great, thank you. I guess just one quick follow-up to Mr. Hagan. You had said, if I heard you correctly, that based on the research, your group is also opposed to those separated chamber for shisha. Is that correct? Oh, you're on mute.
You're on mute, Mr. Hagan.
Thank you, Councillor. It's great to have a public health professional on council. Regarding, what's the question again? Sorry.
Just the, I think I just want clarity. You said you are opposed to separated chambers. Is that right?
Well, we are in support of public health, and being in support of public health means that we stand by the science. The science tells us that there is no way to remove secondhand smoke, no practical means of removing secondhand smoke from a public establishment or workplace, and that's backed up by the American standard. The ASHRAE Standards Association in the U.S.
I do have one more question. I'm happy to ring back in, or I can just ask it.
I don't see anybody else on the board, so carry on.
Yeah, and I guess either to Ms. Drake or to Mr. Hagan, I'm wondering your thoughts on what Mr. Nanda said about this might encourage more indoor or just people smoking shisha in their homes and affecting children's health.
Yeah, I'll have to take that one. You know, as a society, as a council, you have the ability to set social standards. You may not be able to protect children and workers in someone's home, but you can surely do that in public settings and workplaces, and we encourage you to do that. In fact, it's your duty and obligation under Section 7A of the Municipal Government Act.
Great, thank you. And Ms. Drake, do you have anything else to add to that?
I do not know.
Okay, great. Thank you all very much for coming in.
Thank you. I think that completes questions of our speakers then. So thank you all for your presentations and for attending today and for your patience in winding our way through this meeting. I really appreciate it. We'll now go to questions of administration, starting with Councillor Wright. Please go ahead.
Hi, thank you very much. So as part of the motion, it indicates to connect with and engage with other stakeholders, and that would be Mr. Nanda's organization as well, although not specifically stated in the motion?
That's correct. Yeah, we would look to engage with shisha stakeholders. I think just to add to that, we would bring back a report that looked at those new mitigation measures and provide a recommendation. And it would be subsequent to that, that if there was direction from committee to do further bylaw amendments, then we would do a more robust GBA type of engagement with Edmontonians.
Okay. So would that initial report then include any jurisdictional scan of our surrounding regional communities that still allow shisha?
Yes, it would.
Okay. And there was one other. And just for my own clarity, the Provincial Tobacco Act just specifies tobacco and cannabis. Is that correct? It doesn't specifically ban shisha?
Correct. No. Tobacco, cannabis, and there's also the vaping as well.
Okay. So then the hookah pipes aren't considered a vaping product?
Under that legislation, I'll just refer to Tracy with law, but my understanding is that the hookah pipes are not with under that definition of vaping itself. But if you can correct me if I'm wrong there, Tracy.
No, Keith's correct. The provincial legislation gives us a really small gap to deal with non-tobacco shisha products.
Okay, and that's why the majority of municipalities in Alberta then still allow it. I think Mr. Hagan had referenced that 12 that have it banned.
You know, Councillor Wright, I don't have the details of all the municipalities that allow it or don't, so that information would have to come back in the report.
Okay, all right. Well, I totally want to be able to debate it when we do have full information and full stakeholder engagement. So thank you very much for doing the work.
Thank you. Councillor Tang?
Yeah, I wasn't here for that council meeting previously, but I guess I'm just wondering if you can just remind us a little bit of that engagement approach, and whether some of the communities who are deeply affected were indeed connected with.
Certainly, I was around for some of that engagement. We did connect with some of the major players in the industry, and although we didn't do a significant engagement of Edmonton as a whole, there was certainly surveys that were out there as part of the Insight survey and some of that other information, but it was a very narrow engagement process with some of the major industry players out there.
And just in terms of like targeted community conversations?
There was not from a targeted community perspective, yeah.
Okay, great. No, that's it. Happy to speak to it when the time comes.
Any further questions of administration? We'll go to speaking to it. I'm going to take my turn first, simply to give my colleagues fair warning, as it were. We talked about this a lot last term, a lot. The engagement was pretty intensive with those that wanted to continue providing those services. We heard the cultural perspectives. We heard perspectives from other health stakeholders, as has been represented here today. There is, in my view, absolutely nothing compelling that says we should reopen this conversation. There's a modest conversation about maybe the technology is better. The technology is not ever going to be to the place where you can eliminate secondhand from smoke from a person that is standing a couple of feet away from the source of that smoke. It just doesn't happen. We went through this when we had restaurants that were tried to split into smoking and non-smoking sections. We've gone through this conversation up, down, and sideways. There is nothing compelling for me that says we need to go through this again. So I will be voting against this motion, and I just wanted my colleagues to understand that. I have non-committee members on the board. Or is there anybody on committee that wants to speak before I go to Councillor Wright to close? Councillor Knack?
Thanks, Councillor Cartmel. Appreciate those comments. So I was actually open to this only because, but I'm inclined to, I understand your perspective on that, because my view, and from the very beginning, similarly to Councillor Cartmel, was unless we can be absolutely certain, so that's what I would expect in the report if this were to be approved, unless we can be certain there's no secondhand impact. I mean, it'd be great to do all that other engagement, but I don't want to waste your time on other engagement if there is no, if we can prove that there's no secondhand impact. Because if there is, to me, it's a non-starter. Because, you know, we're balancing in the notion of a GBA Bless analysis, there's certainly a cultural element, but what I kept coming back to is that oftentimes workers in these establishments are lower income, might not have other choices, and if you can't guarantee their health, then it doesn't matter about the rest, because then we're putting those people at risk who literally have no other choice. So that's why I'm open to the motion, only because I did sit down with Mr. Nanda before, and he's, you know, I want to give them their chance to show if that can actually happen. And to be very clear, if it can't, and if there's any doubt, I would not support reopening this. So that's where I'm at. So I'm happy to have that conversation only because I have a lot of respect for the work that I know was done, having had that sit-down conversation, and I'd at least like to get our experts' sort of view on that before we make a decision. So, but I'm very much like leaning towards where Councillor Cartmel is, and I'm not an expert in that, and you are an engineer. So if there's no way to do it, then we're done. So that's it for me. Thank you.
Thank you, Councillor Tang.
Yeah, so I'm kind of where Councillor Knack is, quite frankly. I don't necessarily see another presentation or report necessarily change the outcome of what the current policy is. I had brought up, the drinking, allowing alcohol consumption in public parks. I didn't support that, largely because of a lot of the public health concerns. I also recognize that this is not a health board to assess evidence and all that. I can appreciate that, and my stance on this particular issue remains pretty consistent, I would say. But I also heed, the comments from Mr. Nanda about the signal it sends to certain communities that we have, in Edmonton who will be disproportionately affected. And I do feel that if, in the last council, if councillors has said we wanted to see you to do more of this work, and people went away and did that work, and there's no forum to present that back because based on that direction, I think having a fair process, is in order, in my opinion. Again, I don't necessarily feel like it would change certainly my mind about this issue, and I recognize the onus on staff to having to prepare a report and whatnot. But I think in recognition of the GBA plus and the lack of, I think at this point I'm prepared to support this, but I will not be. I don't expect it will change my mind, but I think a fair process is important.
Thank you, Councillor Stevenson.
Yes, thank you. Just wanted to speak in support of this motion. I think my colleagues have touched on all the salient points, just in terms of, we're balancing two different needs potentially in our community in terms of, the importance of creating culturally welcoming spaces, a culturally welcoming city, and also ensuring that we're protecting those who are maybe in vulnerable work conditions as well. So as always, I'm always happy to look for solutions that can achieve both of those things. So providing protections for workers while also enabling cultural practice. So that's my excitement with the work that's been done. And I agree that it's only a fair process to have an opportunity to review the work that has been done and understand if it can be a solution to achieving those outcomes. So thank you to the mover for bringing this forward, and thanks to all of the stakeholders that have spoken today.
Thank you. Anyone else before I go to Councillor Wright? Councillor Wright to close.
Thank you very much. I do encourage my colleagues to support this, and for those who sat on previous councils, I understand the hesitancy to rehash an issue that you've spent a lot of time on, and I do appreciate the time that you do spend on it. But I also feel, in my view, that the industry has done some extensive work, and that was part of the discussion that went on previously is the mitigation factors. I don't think there is any way that we can guarantee that anybody will be not impacted by secondhand smoke, not just from tobacco or cannabis or shisha, but I mean the health impacts of forest fire smoke that we're also inundated with, and I don't think that we can wrap anybody in a bubble to protect them 100%. So I do look forward to the further engagement that's going to be done with the industry, with the cultural community, and I look forward to seeing that information come back then for debate at that time early in the new year. Thank you.
Thank you. So before we vote, we have 4 members of committee here. A split vote means the motion fails. And we've heard from at least 2 people on council that seem to want to consider further work, and we have not heard from Councillor Jans. So I just offer that before this goes to a vote, if people want this requisitioned, now is your chance to say so. Because otherwise it goes to a vote and it may pass, it may not. And it would be requisitioned to the November 14th council meeting.
Mr. Chair, may we requisition then?
That's one. Takes two.
Okay.
Okay, so that's been requisitioned then to council. That was Councillor Wright and Councillor Jantz that have asked this be requisitioned to City Council. It'll be heard again on November 14th at council. So that completes the conversation on item 10.1. Are there any motions without customary notice or notices of motion today? Seeing none, we are adjourned. Thank you.